Good day everyone, my name is Jandy Ambrosi. I am student nurse from University of Mindanao. And today I'm going to demonstrate to you about the starting, regulating, and discontinuing of IV procedure. Now, IV therapies or intravenous therapy delivers fluids, medications, or vitamins directly into the veins of the body. First thing that we're going to do is check the doctor's order. Gather all the equipments and prepare the IV solutions and tubing. Wash hands to prevent the spread of microorganisms. Maintain aseptic technique when opening sterile package and IV solutions. Prevents the contaminations of IV solutions and the set which can affect rapidly the client. Clamp tubing. Uncap the spike and insert it into the entry site on the bag or bottle as the manufacturer directs. If an additive is ordered, incorporate it before inserting the spike into the entry site. Unsuspend the IV solution on the hook in the preparation area and press the drip chamber and allow it to flow at least halfway. Remove the cap and the end of the tubing. Release the clamp and allow the fluid to move through the tubing. This is termed as a priming the tubing. Allow fluid to flow until all air bubbles have disappeared. Close the clamp and recap the end of the tubing, maintaining sterility of the setup. And then, after all, notify the physician or the nurse who will insert the IV when he or she arrives. Bring preparation to the bedside. Identify the client and explain the procedure. Have the client in supine or low collar position in the bed. Starting for intravenous infusion, this IV infusion is giving a liquid substance directly into your vein. Is okay for you, ma'am? Alright, thank you. Suspend the bag or bottle of solution on the IV stand. Hand the tourniquet to the doctor or nurse, followed by the cotton balls with alcohol and the needle or the Basecam. Observe while the doctor or nurse is inserting. Release the tourniquet when he or she indicates or when a return flow of blood to the adapter is observed. Connect the tubing to the needle. Then start the flow of solutions promptly by releasing the clamp on the tubing. Examine the site for signs of infiltration. Support the needle with a small piece of gauze or tissue paper under the hub, if necessary, to keep the needle in place. Loop the tubing near the site of the entry and anchor it with plaster to prevent pulling of the needle. Anchor the arm to the arm board for support if necessary. The physician prescribes the rate of flow, adjust the rate of flow according to the doctor's order, and complete the label and tape to the IBF bag bottle. Do the aftercare of the equipment and wash your hands deters the spread of the microorganisms. Document the procedure and the client's response. Chart the time, site, device use, solutions and rate of flow and the physician's nurse who inserted the needle. Monitor the periodically at least every 30 minutes to check the flow rate and observe the infiltrations and other untoward symptoms. First thing that we're going to do is check the doctor's order. Identifies the drip factor on the IV tubing package, calculates correctly the rate of drops per minute, checks the patency of the IV line and needle, counts the number of drops flowing into the drip chamber for a full minute, tightens or release the ruler clamp until the calculated rate is infusing, monitor the IV flow rate at frequent intervals, documents the type of infusion, amount, flow rate, and client's response to the prescribed infusion rate. First thing that we're going to do is check the doctor's order. Good day, ma'am. My name is John D. Ambrosi. I am your nurse today. What's your name, ma'am? Deb. Okay. Today I'm going to discontinue your IV. Okay. Release the anchorage of arm, tubing, and needle. Loosen the tape at the venipuncture site while holding the needle firmly and applying counter-tractions to the skin. Don gloves and clamp the infusion tubing. Hold a swab above the venipuncture site. Withdraw the needle quickly by pulling it out along the line of the vein. Immediately apply firm pressure to the site using the swab for 2 to 3 minutes. Hold the client's arm or leg above the body if any bleeding persists. Check the needle or catheter to make sure it's intact. Report a broken needle or catheter to the nurse in charge immediately. If the broken piece can be palpated, apply a tourniquet above the insertion site. Apply the dry cotton balls band-aid to cover IV site. Discard used supplies appropriately, remove gloves, and wash hands. The dressing continues the pressure and covers the open area in the skin, preventing infection. Record the amount of fluid infused on the input and output record sheet and on the chart if necessary. Include the type of solution used, time and reason for discontinuing the infusion, and the client's response. To ensure accurate documentations of client's response. This is the end of my demonstration in IV infusion procedure. Thank you.